Hi, I'm Erin with After Cancer, Solutions for Sexual Health and helping survivors find intimacy again. Today's topic is all around questions to ask your medical team regarding the sexual side effects you may be having from your treatment. There may not be practice behaviors in place today for your team, for your medical team to approach you on this topic. You may have something in your written literature that speaks to the sexual dysfunction or the sexual side effects you may be having from your treatment. And that may be considered in their minds good enough in terms of setting the expectation for you. They may be waiting for you to ask the questions of them. And very possibly, there is no good time for them to bring this up with you in private. Because of that, we need to be ready with our questions to ask our team so that we're getting the help that we need. I'm going to give you some example questions that you can use and edit as you need to ask your team regarding sexual dysfunction. The first question, so what treatment side effects can I expect that will affect my marital relationship, will affect my sex life, will affect intimacy with my partner? You can use any of those terms. What of these side effects will be short term and what will be long term? Will any of these be expected to be permanent? Who is the correct person that I should talk to regarding these side effects? What have your other patients found successful in the past in resolving these issues? And what can my partner expect in terms of sexual side effects I may have from my treatment? All of those questions can be used with either men or women, but specifically to women, you can address the menopause symptoms that you read about in the literature that are expected for you to have based on maybe the chemotherapy you're going to have. And you can ask, could you describe what the menopausal symptoms will be, how they will present themselves, and what I can do about it? Is there anything I can do to lessen their severity? Is there anything I can take that will help me through this? Will these be long-term or short-term? For men, you can ask specifically questions around incontinence and erectile dysfunction. So, what sexual side effects will I face because I've had a nerve-sparing treatment? Does that suggest that my nerves are spared and I will be able to get and keep an erection? What have your other patients found successful in terms of products to use after treatment? I see erectile dysfunction advertised on TV all the time. Would those medicines be appropriate for me to use after treatment? And again, what have your patients found to be successful for incontinence or erectile dysfunction? Or, I'm facing some of the some of the side effects that I read about in the literature and that you spoke about before treatment. Is there someone you could refer me to that has had success in dealing with this? Is there anything that I should say to that physician specific about my treatment when I see them? All of these questions are questions to initiate the conversation with your medical team. By you bringing it forward, they will have a chance to give you the referrals or get you the information or give you the resources that you need to help find intimacy again. Another tip to use here is to go to your electronic record and leave a note there about the question that you have. Sometimes it's easier to ask that question online versus in person. Sometimes it's difficult to find people alone in a safe, supportive, and uninterrupted environment to ask the questions. So if you have a MyChart, go out electronically and see if you can leave a note for your physician there. When you call in to ask a question, if you have to do it that way, you can just basically say, my question is around the sexual health side effects regarding my treatment, could you have somebody call me back? Your physician or member of your medical team that you feel most comfortable with will be absolutely happy to talk to you about these issues. You initiating the conversation will give them an opportunity to give you all the information that you need to find intimacy again. Good luck with this. Ask me if you've got any questions about it. I'd like to hear from you by email, erin@aftercancer.co. And visit our website to find other great information and resources regarding finding intimacy again. And while you're there, sign up to join the community of survivors struggling with these same issues. You'll get tips, advice, and resources directly to your email inbox. Thank you for joining me today. I look forward to talking to you again. Comment below, and remember, your questions are always welcomed and encouraged. Or visit us at aftercancer.co.